Hi everyone, my name is Kerry and I'm a newly qualified nurse from Scotland. Mylocum Group has reached out to me on becoming a speaker as part of the Healthcare Summit called Trust Me, I Work for the NHS. So today, myself and many other healthcare professionals will be discussing topics of our choice as part of the Healthcare Summit. So today I'm going to be talking about becoming a newly qualified nurse and experiencing burnout and how to tackle it and deal with it from a personal experience. So a little bit about me before I start discussing my topics. As I said, I am a newly qualified nurse. I've been qualified now for about 4 months, going on to 5 months, which is quite scary at times to say because I don't actually think it's quite settled in. I finished up my studies last year in the middle of summer, just after my management placement, and then went on to start my first post as a nurse in September and then qualifying from a university in November. So my university experience was absolutely amazing. I spent my 3 years studying at the University of the West of Scotland and had the most amazing time there. Definitely working through a global pandemic was not on the cards, but in the end I still had a great experience at university. A few placements I got to experience. I had such a variety. I had a really good variety of placement throughout my time at university. I got to work in a cardiology ward, a haematology and oncology ward, dialysis unit, care home and many more. But definitely one of my favourites was in my very first year. I think it was my second or third placement, and that was working in the community with the district nurses. And it must have stuck being one of my favourites because that is what I do now as my first post as a nurse. Becoming a newly qualified nurse is very exciting but also very nerve-wracking at the same time. I remember sitting this time last year on my final stretch of university getting ready to apply for jobs and also start the interview prep for when the time came. And I remember so many people telling me the interview time will fly past and you'll be qualified before you know it. And I know myself, I definitely did not believe them, but I definitely do believe them now. Sitting here, nearly qualified, 5 months, the time definitely does fly past. So my first tip would be definitely to start the interview prep early. Go for as many interviews as you can to get all the experience you can behind you. And after every interview, either if you were successful or not successful, being able to ask the individuals who are interviewing you, what you've done well or things you could work on, and knowing your strengths and weaknesses throughout the interview process definitely does help for future interviews, either as when you are a qualified nurse or when you are in the interview process of applying for jobs. A big thing to remember is that everyone you work with has been in the same situation as yourself before. They've all been newly qualified at some point and know how daunting and scary it can be being newly qualified and in your first position and unsure on things, because not everyone knows everything at the first instance. Whether they've been qualified for 30 odd years or qualified in recent years, everyone knows and will not forget that feeling of being newly qualified. And when you first go in your post, everyone you work with will not expect you to know everything, because knowledge and experience comes with time, and definitely everyone understands that and everyone's been in the same boat before. I need to apologise for the lightning change. Scotland's weather is very indecisive today and it's not been my friend, so I've had to pop on a few lights. But following on, I remember when I first started my posting community, I wanted to learn everything at once, and there was definitely some things that scared me going in as my first post, such as working with syringe drivers. Syringe driver is a pump that runs over 24 hours delivering pain medication to a patient, and we go in as district nurses to renew the pump every 24 hours with controlled drugs. And I remember when I first started, I was feeling really nervous. I started my post as a band 4, so I wasn't yet qualified. I had to wait a month for my PIN to come through so I could work as a registered nurse. And in that time, I had said to the girls that I work with, I want to experience everything that I can before I finally get my PIN through and I'm out on my own. And in that time, I got to shadow the girls that I work with and be able to see so many different things, such as syringe drivers, pick line care, diabetics in the morning because I couldn't yet administer the insulin because I didn't have my PIN through. So that when I became the band 5, I was confident going out myself, and working myself as well, because a big thing in the community is you are out there on your own, other than syringe drivers, because that is a double nurse task. And it is quite scary going out on your own. It's definitely quite daunting at times, you know, going into someone's new. It definitely is daunting when you finish your shadowing period. So myself, I went out in the community myself, you know, I'm driving about, going to new patients and at different visits as well. So it's definitely a big thing to make sure you feel confident enough to deal with patients yourself, and safely in doing so. And the next topic I'm going to be talking about is burnout. So although you are newly qualified and you want to do everything at once and learn everything you can, I know I experienced burnout during being a student as well. It's a lot to take in. You're doing so many things at once. You've got essays due, you've got placements, you've got exams, and it's the same being newly qualified as well. You've got everything at once. You've got training, you've got work, you've got doing that studying at home to make sure that you feel happy going in and doing things. And it's definitely, you can overthink things very, very easily, and it is definitely important to recognise the symptoms of burnout and if you are experiencing it. Signs and symptoms of burnout to keep an eye out for are anxiety, this could be generalised to going to work, tired or fatigue, overwhelming feelings about going to your work, you know, sometimes if you're dreading it, exhaustion, this could be emotional and physical, and sometimes you feel like you're losing your spark, you know, you don't want to go into work. As I've said, you could have a dreading feeling going in, and then when you come home you don't feel appreciated in a way. There's many causes to burnout, and this can vary from person to person as well. It could be work environment, staffing, not being able to take your breaks, you could just feel completely overwhelmed. It's very important to recognise these feelings and get support if you are feeling like this. The NHS Better Health, Every Mind Matters website is a really good website to have a look on, and it shows the signs and symptoms to keep an eye out for, ways of coping with burnout as well, and support on how to deal with this as well. There are many ways to prevent and recover from burnout, and the NHS website I mentioned before have some good sources to help recover and prevent burnout as well. But from my personal experience, I found that nourishing myself, giving myself self-care, I'm a really big self-care advocate, looking after your body and getting some good sleep, taking some annual leave, just taking a step back from work and just helping your body kind of recover itself. And also when you're in work, seeking support, and a big advocate for taking breaks. I know sometimes days can be hectic, but you really do need to take your breaks and help your staff as well when they need to take their breaks as well, especially after a long difficult day. So on a whole, if you think you're experiencing burnout, definitely reach out and get support. No one's going to fault you at all for reaching out support where it's needed. And if you're newly qualified like myself, or you're in the future to be a newly qualified nurse as well, huge good luck to you. And I just want to say a big thank you to Mylocum Group for inviting me to be a speaker as part of the Healthcare Summit. And yeah, thank you very much for listening. I'm Nursing with Kerry on Instagram if you want to give me a follow. I think I've just rambled on here, but thank you very much for listening, and see you later. Bye!
I'm fresh out of training, and I'm going to be talking to you today about the transition from student midwife to newly qualified midwife.